If you're over 60 and no longer waking up with that morning erection, don't just blame it on age, okay? This is a warning signal your body is sending you. And if you ignore it, you won't just lose out in the bedroom. You're compromising your confidence, your vitality, and even your cardiovascular health. Erectile dysfunction isn't just about sex. It's your body's alarm bell, telling you something's wrong with your circulation, your pelvic floor muscles, and internal changes that affect your overall health. But here's the secret nobody tells you. This isn't permanent. Can it be reversed? Yes. I'm Adria Lara Montero, a urologist and specialist in men's health, with over 15 years helping mature men reclaim the strength, energy, and confidence they thought they'd lost forever. In my practice here in Brazil, I've already helped men in their 60s, 70s, and even older recover their natural erections without relying solely on medication, using science-backed techniques designed specifically for the mature male body. The real problem is that most men focus only on testosterone and drugs while ignoring the root cause. Today, I'm sharing with you 4 specific exercises designed to restore blood flow, strengthen key muscles, and revive sexual function naturally. One of them is so rarely discussed, but so effective, it might surprise you. Why erectile dysfunction can be reversed. Stick with me. The best is yet to come. Before we start, if you haven't subscribed to the channel yet, I invite you to do so now and turn on the notification bell so you don't miss important health tips made especially for men over 60. And if you find this content useful, write 1 in the comments. If not, write 0. Your comments help me create more valuable information for you. Now, let's get to the first and most essential step, an exercise that targets the foundation of your sexual function, the pelvic floor muscles. Strengthening these can dramatically improve the quality and control of erections, especially for men over 60. Number 1. Pelvic floor activation, male Kegels. I'll never forget the expression on a 67-year-old patient's face when I saw him here in São Paulo. Newly retired, married for over 40 years, he sat in front of me with his eyes downcast and said, "Doctor, I still love my wife, but I don't feel like a man anymore." He'd started losing his erections gradually at first, then completely. No medication helped, but in 8 weeks with a simple daily practice I gave him, he came back smiling. His words were, "Doctor, I feel alive again." That practice was pelvic floor activation, or what most people know as Kegel exercises. Contrary to what you might have heard, Kegels aren't just for women or urinary control. No, for men, especially after 60, they're the most powerful and natural way to rebuild sexual strength. Why? Because the pelvic floor muscles are responsible for controlling blood retention in the penis during an erection. When these muscles are strong, they contract and hold the blood in the erectile chambers, keeping the penis firm. When they're weak, the blood escapes quickly, leading to weak or short-lasting erections. Most of the men I see have never exercised these muscles before, but when they start, everything changes. Longer and stronger erections, better control during sex, and even a renewed sense of energy and confidence. No gym needed, no equipment, just consistency. Here's exactly how to do it. First, find a quiet place where you won't be interrupted. Sitting or lying down, it doesn't matter. The goal is to identify the muscle group, right? The easiest way? Imagine you're urinating and try to stop the stream mid-flow. That internal squeeze you feel is your pelvic floor. You're not tensing your abs, legs, or glutes, just that internal muscle. If you put your hand on your belly and feel movement, you're doing it wrong. It should be subtle but controlled. Now that you've identified the muscle, contract it. Hold the contraction for 5 seconds. Really feel that deep engagement. Then release and rest for 5 seconds. That's 1 rep. Start with 10 reps in a row, which will take less than 2 minutes. Try to do this routine 3 times a day. once in the morning, once in the afternoon, and once before bed. After a couple of weeks, you can increase the contraction hold to 7 seconds, then 10, gradually building muscle endurance just like you would for any other body part. After 4 to 6 weeks, many men start noticing firmer erections, longer-lasting performance, and in some cases, more intense orgasms. It's a simple habit, but the impact on your sexual health can be profound. And when done regularly, it becomes empowering. You're not just waiting for your body to work, you're taking control of it. That's something no pill can give you. Now, if this first exercise works by strengthening your body's deep muscles, imagine what happens when we stimulate the blood flow system that fuels those erections. In the next method, I'll introduce a technique I use with my patients that could become your new favorite habit. Number 2. Diaphragmatic breathing and pelvic flow mobilization. I always remember the story of a man in his early 70s who came to see me. Healthy, active, still working part-time, but deeply frustrated. "I can't relax," he told me. "Even when I want to be intimate, I can't be in the moment. My mind races and my body doesn't respond." What he was describing wasn't just mental, it was physical too. Chronic tension, shallow breathing, and subtle anxiety were shutting down the system responsible for erections, his parasympathetic nervous system. And what helped him most wasn't medication. It was a breathing exercise. It sounds too simple to be true, but diaphragmatic breathing, also known as deep belly breathing, has a direct and powerful impact on your ability to achieve and maintain an erection, especially after 60. As we age, our bodies tend to operate in a low-level stress state. Muscles stay slightly tense, blood vessels constrict, and our breathing becomes shallow and rapid without us noticing. This fight-or-flight state reduces blood flow to the pelvic area, the exact opposite of what your body needs during arousal. When you learn to breathe intentionally, using your diaphragm, you shift into rest and digest mode. This activates your vagus nerve, lowers cortisol levels, reduces blood pressure, and, most importantly for our purposes, increases blood flow to the pelvic region. That's exactly the kind of flow an erection depends on. Here's how to do it. First, find a quiet space where you can lie down or sit comfortably with your back supported. Place one hand on your chest and the other on your belly. Now, inhale slowly through your nose for about 4 seconds. As you inhale, feel your belly, not your chest, rise under your hand. Hold the breath gently for 2 seconds. Then, exhale slowly through your mouth for 6 seconds. Feel your belly fall. That's a deep, diaphragmatic breath. Repeat this cycle continuously for 5 to 10 minutes. You'll notice your heart rate slows, your shoulders relax, and your mind clears. For the best results, I recommend doing this at least twice a day, once in the morning to set the tone, and once at night to unwind. And if you feel anxious or disconnected during intimate moments, dedicate 10 minutes to breathing like this beforehand. It makes a noticeable difference. Over time, this simple breathing pattern helps regulate your body's natural rhythm. More oxygen reaches your blood, your vascular system becomes more receptive, and erections become easier to achieve and maintain because you're no longer fighting your body, you're working with it. I've seen men who were convinced they were too old or too far gone rediscover full, natural erections after incorporating this into their daily routine. And perhaps equally important, they felt relaxed and connected again with their partners and themselves. Now, if you think breathing can help awaken your erection, wait until you see what happens when we introduce a device that literally draws blood to the penis, training your body to function again, even after years of dysfunction. The next technique is a cornerstone of erectile rehabilitation and easier to use than you might think. Number 3. Penile vacuum pump therapy. Blood flow retraining. I still remember the first time I introduced a vacuum pump to a 65-year-old patient. He was skeptical, maybe even a little embarrassed. You want me to do what with that? He asked, half laughing, half uncomfortable. But I could see his frustration ran deeper. He'd tried pills, waited it out, blamed himself, but nothing worked. 2 months later, that same man walked into my office with a confidence I hadn't seen before. I'm having real erections again, doctor, like I haven't in years. That's the power of vacuum pump therapy. And once you understand how it works, you'll see it not as a gimmick, but as a tool to retrain your body to function as it always should. As men age, blood flow to the penis can decrease due to narrowed arteries, lack of activity, or underlying conditions like diabetes or hypertension. Without consistent blood flow, penile tissue starts to weaken and lose elasticity. That's where the vacuum pump comes in. It works by using negative pressure to gently draw blood into the penis, expanding the vessels and stretching the tissue in a way that mimics natural arousal. Over time, this improves circulation and helps restore the natural erection mechanisms. Using it correctly is simple but crucial. First, choose a reliable, medical-grade vacuum erection device. It can be manual or battery-powered. The key is that it creates gentle, consistent suction. Start by applying a small amount of lubricant around the cylinder opening for a proper seal. Then, insert your flaccid penis into the tube, hold the base firmly against your body to maintain suction, and begin pumping slowly. You'll feel the pressure drawing blood into the penis. In a few seconds, it will start to expand and firm up. This isn't about sexual stimulation, it's about training your body. Once erect, you can maintain the vacuum for 10 to 15 minutes. Some men use a soft constriction ring at the base to temporarily retain blood, but this should only be done with proper instructions. The goal is to improve blood flow without discomfort or damage. Start with this routine 3 times a week. Some men eventually increase to daily use, but always under supervision and never more than 30 minutes per session. But it's not about more. Consistency is what matters. What's most important is what happens afterward. Over several weeks, men report firmer morning erections, better response during intimacy, and even increased penile sensitivity. It's like waking up a part of your body that was asleep. And unlike medications, this method supports the natural erectile process. It's not just a temporary fix. This therapy is especially powerful when combined with the first 2 exercises. You're strengthening the muscles, calming the nervous system, and now restoring vascular flow, all key systems working together. For many of my patients, this combination finally delivers results after years of struggle. But we're not done yet. There's one more technique that's rarely discussed, often misunderstood, but scientifically backed to support not just stronger erections, but real improvements in length and tissue health. If you've never heard of it, don't worry, most haven't. But once you know, it could change how you view your own potential. Let's move on. Number 4, Penile Extender Protocol, the powerful, hidden stretch. A few years ago, a man in his late 60s came to my office defeated. He'd tried everything, pills, pumps, exercises, but still felt like something was missing. He told me, "Doctor, I don't just want to function again. I want to feel like myself." That's when I introduced something he'd never heard of, the penile extender. At first, he was doubtful. It sounded strange, even a bit extreme. But after a few months of consistent use, he returned with a quiet pride. My erections are stronger, longer lasting, and I've noticed a length increase that gave me a renewed sense of youth. I didn't think this was possible at my age, he said, but it was. And it still is, for any man willing to follow through. Penile extenders aren't widely known, but they've been used in clinical practice for years to help men recovering from surgeries, injuries, and age-related decline. What makes them effective is the principle of gentle traction. When applied over time, this traction stimulates cellular regeneration, improves blood vessel growth, a process called angiogenesis, and promotes tissue elasticity, all critical components of healthy erectile function. Here's how to use it correctly. First, select a high-quality extender device. Avoid cheap, generic versions online. They're often poorly made and uncomfortable. The best devices are adjustable, come with padding or glands support, and allow for progressive tension. Start by carefully fitting the device onto your flaccid penis. It should be comfortable, not painful. The tension should be light at first, just enough for a gentle stretch without discomfort. Use it for 30 to 60 minutes per day during the first week. As you get more comfortable, gradually increase to 1 or 2 hours daily. Most protocols recommend continuing for at least 3 to 6 months. This isn't a quick fix. It's a long-term solution. What you're doing is conditioning the penile tissue to grow healthier, stronger, and more responsive. Many men report not just stronger erections, but also greater confidence, better sensation, and in some cases, measurable length gains. The key is consistency and patience. Think of it as physical therapy for your sexual health. What makes this method unique is that it goes beyond function. It can also help with mild penile curvature, performance anxiety, and the psychological weight that often comes with years of decline. It gives men back a sense of control over their bodies, something that often feels lost after 60. And unlike pills or short-term solutions, the changes from extender use can be lasting. I've seen men not only restore their sexual function with this device, but completely reframe how they view aging. For some, it's no longer about trying to keep up. It's about reclaiming their full potential. Now, one question I get a lot in the comments and office. Doctor, I had prostate cancer surgery. Will these exercises work for me? Look, this is a super important question, and I'll be direct with you. After prostate surgery, recovering erectile function can be more challenging, but it's not impossible. Kegel exercises are especially important in this case because they help with control and function recovery. The vacuum pump, in fact, is often recommended by urologists as part of post-surgical rehabilitation. But here's the most important part. If you've had prostate surgery or any other urological procedure, you need to work with medical supervision. Every case is unique. What works for one man may need adjustments for another. In my office, I create personalized protocols considering surgical history, current medications, and health conditions. So if that's your situation, don't give up, but seek professional guidance to do it safely. Guidance for post-prostate surgery. And about where to get these devices? Another common question. I always recommend shopping at specialized medical supply stores or larger pharmacies. Avoid super cheap products without certification. The vacuum pump and extender are investments in your health, so quality matters. In the video description, I'll leave some tips on what to look for when choosing these devices. Where to get the equipment safely. Now, if you've made it this far, you've learned about the 4 key exercises that rebuild erection strength from the inside out. But don't go yet, because in the final part, I'll share how to put it all together in an easy-to-follow plan. Plus, explain how to integrate these exercises into your daily life without hassle. Let's wrap this up strong. As a urologist who's worked with men for over 15 years, I've learned that the most powerful changes don't always happen in the office or with a prescription. They happen when a man decides to take quiet, consistent control of his health, day after day. And if you're still watching this, I believe that's exactly where you are right now. We've covered 4 exercises that, when practiced regularly, can change everything about how you experience intimacy, connection, and confidence. The first, pelvic floor activation. It's about building strength at the root. These deep muscles control blood flow in and out of the penis, and strengthening them can lead to firmer, longer-lasting erections that return night after night. The second, diaphragmatic breathing. It's about reestablishing your body's natural arousal system. It helps calm your mind, reduce anxiety, and open the vascular channels that direct blood where it's needed most. The third, vacuum pump therapy. It's a mechanical way to awaken dormant erectile tissue, improving circulation and oxygenation in a way no pill can match. And the fourth, the penile extender. Perhaps the most overlooked method, but one that offers long-term gains in both function and physical confidence when used correctly. I know it might seem like a lot, 4 techniques, new habits, new tools, but what I've seen repeatedly is that men over 60 are some of the most resilient, dedicated, and determined patients I've worked with. Once they understand the why, they commit to the how. And that's where real change begins. These aren't just exercises. They're signals to your body that you're not done, that you're not fading into the background, that you still want to love fully, live deeply, and feel proud of the man you see in the mirror. Some men tell me they wish they'd known this sooner. Others say it gave them a second chance they never thought possible. And some say it saved their marriage. I can't promise these steps will work overnight or solve every issue, but I can tell you this: they're safe, tested, and based on decades of clinical experience. Most importantly, they give you a way forward without relying solely on medications or waiting for things to get worse. You shouldn't have to settle for silent frustration or hidden disappointment. You've earned the right to feel strong, vital, and completely free to enjoy these years without shame or limitations. And if you start with just one of these techniques today, you're already moving in the right direction. So my invitation to you is this: pick one of these 4 exercises and start today. You don't have to do it all at once. Start with what makes the most sense for you. If you're dealing with anxiety, maybe diaphragmatic breathing is your starting point. For direct results on erectile function, perhaps the Kegels. The important thing is to begin. And tell me in the comments which of these 4 exercises you're going to try. Write 1 for Kegels, 2 for breathing, 3 for the vacuum pump, or 4 for the extender. And if you've had prostate surgery and have specific questions, write surgery. I'll make a special video about it. If you know someone who could benefit from this info, a friend, brother, husband, share this video. Men's sexual health is still taboo, but the more we talk openly about it, the more men get the help they need. Thank you for letting me guide you on this journey. I hope you stick with it, because if you stay consistent, what you'll gain isn't just better performance, it's a whole new quality of life. Big hug, and see you in the next video.